Good morning. It's another Thursday edition of Coffee with Curare. I'm Jerry Ramusak. I'm here with Ian Sons today. We're going to be taking you on a majestical journey of rainbows, unicorns, and cute little kitty cats, also known as the worlds of Locum Tenens recruiting. We're going to talk about Locum Tenens today and the advantages that you as our client hospitals might have to use Locum Tenens, and why you as a physician or clinician might be able to jump into the Locum Tenens training, give it a try perhaps if you haven't already. So we're going to bust out a few facts today, have a good time with things, and I'm going to pass it off to Ian here to get us started.
Sure, thanks Jerry.
You got it.
The number one reason why an employer is going to need locums coverage is really pretty straightforward, and I think anybody who's in the healthcare industry knows there's a huge shortage of physicians. And that's number one. And there are a lot of employers that for a variety of reasons don't have the coverage they need. They've done a community needs assessment, they've determined how many providers and of what specialty are required based on their service population, and they're coming up short. And they very well may be doing the best that they can to identify full-time permanent employed physicians for that coverage, but in the interim, they've got to provide that service to the community. So that is the primary focus for locums, but what we see is there's a ton of other reasons why an employer might be interested in bringing on a locums physician. One of those could simply be gap coverage. Somebody gets injured, somebody gets sick, somebody needs to take medical leave, someone might be starting a family and they need time away from work. There's a million reasons why someone might be away for an extended period of time and you need to provide coverage. It could be as simple as a week-long vacation where you need someone to step in and make sure that things don't fall through. A lot of other things that we see are when employers are deciding about maybe starting a new service line, bringing a new specialty into the fold, whether it's a hospital or a private group, and they're not really sure, is this something that we're ready to invest in 100%? Are we ready to build this in terms of marketing, attracting multiple physicians for this specialty service line? Locums can be a good way to kind of bridge the gap and figure out, does this make sense? Are we really going to have the volume of referrals to support bringing this into the fold? Kind of similar to that would be these temp to perm situations that we see a lot. We like to try to call those kind of try before you buy in some ways. And it really allows an employer to make sure that they're comfortable with whomever they've selected. And a lot of times it can be a great situation when you're trying those new service lines like I was talking about. If they end up working, hey, you've got somebody right there who's built it up, has helped you to make it successful. Likely that might be someone who is enjoying the job and the community enough to want to stay.
Right, and you bring up some great points there, and especially let's talk about gap coverage for the clients out there. The gap coverage is a really big thing because that's a benefit you could actually offer your employed physicians is, hey, you want to take a sabbatical, you want to go on your missionary trip, we're going to allow for you to take that month off every couple of years to get your batteries recharged. Because right now, physician burnout is a really big factor in our industry. Let's face it. I mean, physicians get burnt out at these same opportunities that they work at, and we both have been doing this a long time, and we saw where physicians used to stay at jobs for 8 to 12 to 15 years very regularly, and if we weren't seeing that kind of commitment on a CV, they were hard to move forward, and those days are changed. I mean, physicians job hop now just like a lot of normal people, and preventing burnout is a big reason why these clients want to utilize locums and allow these physicians to maybe take a month off here or there to recharge their batteries, take a small leave of absence, and actually use that as a benefit that you could offer your physicians to show them that you care about their mental health and their mental well-being to avoid burnout. Because we hear it all the time. Burnout is one of the biggest factors in the industry right now. Physicians are retiring early. Physicians are urging their children to go into technology fields instead of medicine because of physician burnout and all that they're faced with. Being a physician is actually a very stressful job. While it's rewarding, you also face a lot of stress. So that gap coverage situation is a very big deal for these hospitals.
And to really quickly add to that, another thing that we see kind of as an added bonus for employed physicians is when that healthcare organization decides, look, we want to try and give these people a little bit of a break. They've been taking really heavy call, whatever the case might be. They might employ a regular locums physician to come in every week, every other week, and just take extra call. And like you're saying, it really helps to provide that work-life balance that a lot of physicians are looking for. And just as you outlined, Jerry, that's a big reason why people are leaving their positions and looking for something else, maybe choosing to retire early. So anything you could do as an employer to ensure that people are happy and healthy and most importantly, they feel good about what they're doing, you should take advantage of it.
And a lot of our clients, I think they hear the word locums and they're very worried about the costs associated with locums. But if you want to give us a call, we don't have time to talk about it with Coffee with Curare here, but in reality, it's sometimes cheaper to utilize locums physicians. You're not paying employment taxes. You're not giving them health benefits. You're not doing your 401k match. You're not giving them a big sign-on bonus. You're not giving them relocation expenses. You are reimbursing their hotel and travel and paying them a fairly decent wage through us. But in the long run, you end up at a little bit of a break-even scenario, and you have a lot of flexibility. And that's the other nice thing about locums is the flexibility factor. Yeah. Ian mentioned try before you buy earlier, and you could try several physicians before you buy, and maybe you buy one of those several, or maybe you buy none. And none of them come on permanently, but you have several physicians on your staff now that are credentialed, and you go back to that well and always meet your staffing needs, because the truth be told, when we get a locums assignment, finding the candidates is relatively easy. Now we have to go through the paperwork and credential them, and that's something that Curare does very, very well. We hold their hands throughout the process. We've been working with physicians for a long time, and know filling out paperwork is not always their forte or favorite thing to do. So we help that along as much as possible. So if you're a client looking to fill a gap or get some coverage, expand service lines, give us a call. We'll help you out. You call us today, we'll have CVs on your desk tomorrow, I promise you. For the next part of the segment, we're going to talk about why you as a physician or a clinician might choose to do locums. There's a myriad of reasons, and one of the biggest ones, money. Yep.
Sure. I think that a lot of the physicians that we get who are inquiring about locums, in particular those who have never done so before, they're looking for a way to supplement their income. And whether it's a couple weekend shifts here or there, maybe you're working as a hospitalist and you want to pick up some additional shifts in your off weeks, whatever the case might be, that's usually what we're seeing when it's coming from the candidate side, is an opportunity to really increase their income substantially. And if you think about over the course of a year, if you're working a few weekends a month, that's going to add up very quickly and produce a substantial return for you by the end of the year.
Absolutely. Another great reason to do it is simply to travel. Go see different parts of the country. You could go and follow your hobbies. If you're a skier, you could find assignments in rural areas out west that are really close to ski resorts in the wintertime, and then take your wakeboard down to South Carolina in the summer and find lakes to wakeboard on all summer. Whatever your hobbies might be, there's a place or a location that probably could utilize your services where you could get out and try some new locations to perform those hobbies. For physicians that want to do locums, because you get to see a lot of the country, you can kind of pick and choose where you want to work. Your travel is always paid for and reimbursed, and you're making pretty good money while you do it. So it's a real neat opportunity to get to see the world. You get to, or the country rather, you basically get paid to work a vacation if you would. It's like a working vacation. So, and going back to what we mentioned on the client side of things, it's burnout combatant. I mean, if you're in a job, you've been there for 6, 7 years, 8 years maybe, what better way to go do something than go to a different opportunity for a week here, a week there. Maybe it's even while you're using PTO at your other job, so you're getting paid on PTO. You go do a week of locums. Maybe you pick up some fresh new ideas while you're there and get some new perspectives. And it's really good burnout combatant for the physicians as well.
And the other thing that relates to physicians as well as employers, we were talking about this earlier, is kind of the try before you buy model. A lot of physicians that we talk to, maybe they've gone into their first position, and a lot of times you don't really know what you don't know going into that job. You end up realizing, hey, I figured out this doesn't really work for me in the way that I'd hoped. I did my research, I thought this was going to be a good match, and it turns out after a couple of years, it's not really what I expected. This isn't what I want. And as a result, maybe you're hesitant to say, I'm ready to go and sign another 2 or 3 year employee agreement, maybe longer at times. Sometimes we see 4 or 5 years even, a lot of times tied to significant loan repayment, things like that. But if you're in that situation where you really are wanting to do your due diligence and be cautious about where you're committing, knowing that you don't want to hop from one job to the next, locums can be a great way for you to investigate an area, investigate an employer, get a good level of comfort with who you're working with and the surroundings, and really make sure that this is going to be a good fit for you long term. So we see a lot of that as well, physicians who say, look, I really like this sounds good, but I've kind of been burned in the past. Is there a way that I can maybe try this for a little while and just make sure everything's good before we commit to a long-term arrangement?
Right. And that works out for both parties.
It does.
Then you know what you're getting into. So as you can see, there's a lot of reasons, and we haven't even mentioned them all here, of why you might want to consider doing locums. Right now, about 25% of all physicians say they're going to do locums sometime over the course of the next 2 years. So it's a huge growth field. There's a lot of opportunity. If you're thinking about doing it, give us a call. We've got a lot of opportunities right now to hook you up with, and we can get you started in on a position as soon as we get your credentials. So call us this week, and we'll see you next week on Curare Coffee with Curare. Have a great weekend, and be safe.